Hello, it's Dr. Hafsa. Are you tired of your migraines? Well, it's time to bid them goodbye. Let's dive in and discover your path to relief. Migraine is a severe headache that causes throbbing, pulsating head pain on one side of your head. This occurs when there's a dysfunction in between the brain and the nerves, leading to abnormal release of neurotransmitters. There is a change in the blood flow and there is inflammation of the brain. This collectively leads to migraine, which is the headache phase, and it lasts for 4 to 72 hours. There are four phases of migraine, and we're going to learn about them. The most common categories of migraine are migraine with aura. This is the classical migraine, whereas the more common migraine usually occurs without an aura. The prodrome phase is the phase that begins up to 24 hours before you experience the headache, whereas the aura lasts for 5 to 60 minutes. In the prodrome phase, you might experience a difficulty in concentrating, irritability, nausea, fatigue, and sensitivity to light and sound, whereas in the aura phase, which is a group of sensory, motor, and/or speech symptoms that act as a warning sign of migraine headache. This includes muscle weakness, visual changes, which includes flashes, blind spots, ringing in your ears, tinnitus, sensitivity to touch, that is, you will feel as if someone is touching you, numbness and tingling, and difficulty in speaking or concentrating. You must be wondering what triggers your migraine. A trigger is something that initiates the onset of symptoms. In cases of migraine, it can be stress, hormonal changes, certain medications like antidepressants, proton pump inhibitors like omeprazole, esomeprazole, oral contraceptive pills, nasal steroids, and decongestants. Changes in your sleep schedule, too much or too less sleep, weather changes, overexertion, too much caffeine, missing a meal, exposure to bright lights, loud noises, or strong odors, food additives like nitrates and MSG, which is found in processed food or fast food, fermented or pickled foods, too much alcohol, refined sugars, aged cheese, and dairy products. All of this can lead to migraine. You can keep a migraine journal to track the similarities between your migraine attacks. So, how can you relieve your migraine? The first and the foremost thing is to identify and avoid your migraine triggers. You can use medicines to stop migraines that are taken when you have the first sign of migraine, for example, triptans and metoclopramide. The medicines to prevent migraines are taken on a daily basis and they reduce how often and how severe migraine affects you, like calcium channel blockers, beta blockers, and tricyclic antidepressants. You can take vitamins like riboflavin 400 mg per day, magnesium, and feverfew, which is a herb that was discovered in ancient times to reduce fever, arthritis, migraines, and many other diseases. Coenzyme Q10 is an antioxidant which is taken to boost your energy levels in the brain cells and it helps reduce migraines. You can use relaxation techniques like yoga. You can get acupuncture done. This basically changes or modifies the pathways in your brain that turn off the pain signals. Botulinum toxin type A injections or Botox is a FDA approved treatment for chronic migraines. This injects the botulinum toxin around the pain fibers and this blocks the chemical transmitters that increase the pain signals in your brain. Resting in a dark, quiet, cool room also helps. Applying a cold compress or washcloth to your forehead or behind your neck causes vasoconstriction and decreases the inflammation around your blood vessels or the brain, which eventually decreases migraine. Massaging your scalp and applying pressure to your temples in a circular motion also helps. I hope this video was helpful. Please like, subscribe, and follow for more content like this.